You're listening to a brief excerpt from Is Your Sterile Processing Department Safe? Risks and Opportunities in Sterile Processing. This webinar, co-sponsored by DNV GL Healthcare, asks, are your surgical patients safe? And provides insights from Jeremy Gibson Rourke, Clinical Surveyor, DNV GL Healthcare, along with Stephen Cuthbertson, Executive Director of Risk Management, Performance Improvement, Customer Service, Case Management, and Regulatory Compliance at College Medical Center.
All right. Well, I just want to start by thanking everybody for their time today in this important topic in healthcare and a focus that we've seen throughout the country. I'll start by giving you a little bit of an introduction to DNV GL for those of you that are not familiar. DNV GL is a global quality assurance and risk management company with a purpose of safeguarding life, property, and the environment. We enable our customers to advance the safety and sustainability of their businesses. We are a global company with local competency. DNV GL has been around for over 150 years and has over 12,500 employees. Our global reach and density of offices around the world is another factor that enables us to take a broader view. DNV GL has 5 service areas, and that's maritime, oil and gas, energy, digital services, and business assurance. DNV GL Healthcare is a part of the business assurance area. As you can see, the scope of DNV GL Healthcare accreditation and certification is listed there. We do everything from hospital acute care accreditation, critical access accreditation, and then certification processes. And the one we'll specifically be speaking about today is our sterile processing certification. I was very fortunate to work with Stephen and his team with our first sterile processing certification. They did a wonderful job in our first survey, and I appreciate them stepping out and taking that journey with us. And so I'll turn it over here to Stephen to speak a little bit about their journey to sterile processing certification.
Thank you, Jeremy. Good morning, everybody. I'm very excited to actually be able to share our journey with you. We learned a lot during this journey, and we're very fortunate to have Jeremy as our surveyor, who provided us some very essential education throughout the entire process. Let me begin with just a little bit of background on my facility itself. We are in Long Beach, California, and yes, every day looks just about like that. For those of you who don't have the luxury of average of 70-degree temp every day, I apologize, but we do benefit from that here as well. Why we decided to go with the sterile processing certification is partly due to a few things. We are strategically located in Long Beach, and we have several hospitals around us that are much larger than us. We are a licensed 244-bed, for the most part, behavioral health facility. We had 6,019 behavioral health admissions last year. That runs about our annual number. And we saw 16,411 emergency visits last year with a very small but efficient emergency room. And we were looking for something that would set us apart from those area hospitals that are around us. We don't have the volume to support things like BAD or stroke, hip and knee. But when we looked at the the sterile certification standards, we felt like that was something that we could actually attain.
You've been listening to a brief excerpt from the Is Your Sterile Processing Department Safe? Risks and Opportunities in Sterile Processing webinar presentation. This webinar was co-sponsored by DNV GL Healthcare and recorded on April 11, 2019. The full webinar included discussion from Jeremy Gibson Rourke, Clinical Surveyor, DNV GL Healthcare, along with Stephen Cuthbertson, Executive Director of Risk Management, Performance Improvement, Customer Service, Case Management, and Regulatory Compliance at College Medical Center. The full webinar also includes an extensive Q&A session with the audience. You'll want to be sure to watch the full 1-hour webinar video. To do so, use the link appearing now on your screen.